In my clinical practice, I have observed that almost 70% of varicocele patients are lean or have a low body mass. Now, this raises an important question: why does varicocele seems to affect thinner individuals more commonly than others? Now, let me be clear. Varicocele can occur in people of all body types. Even individuals with average or heavier builds may develop varicocele due to other factors like prolonged sitting, genetic inheritance, or increased abdominal pressure from obesity. But in lean individuals, certain patterns and risk factors show up more frequently and more visibly, which we will explain now. In many of these lean patients, one of the most consistent issues we observed is constipation. When someone is constipated, they tend to strain more while passing stool, as there is less abdominal fat and muscle bulk to buffer the internal pressure. This pressure is then transmitted downwards towards pelvic and scrotum, where it overloaded the delicate scrotal veins. And since the scrotum is made up of soft tissue with no protective bone or large muscle in the area, that extra pressure directly affects the veins, leading to development of varicoceles over the time. The second reason is exercise. Many lean people, in their effort to build muscle or gain weight, start gym, workouts and strength training. While exercise is healthy, heavy lifting, especially without proper support, can lead to sudden spikes in abdominal pressure. Whether it's lifting weights, running or cycling, all of these can put direct stress on the lower body. If done carelessly or without using protective supporter, this pressure can damage the veins in the scrotal area. Our third factor that's often overlooked is two-wheeler riding. Yes, even sitting on bikes or a scooter for extended period can cause continuous micro trauma to a pelvic region, specifically scrotum. Riding a bike creates constant impact. This repeated jarring causes low-grade inflammation, which over the time can damage the vein walls. Think about it. Your scrotum is already heat sensitive and the designed to adjust its position based on temperature. When you sit for a long duration on a bike or a scooter, your scrotum comes in a direct contact with the seat. This means every jerk is absorbed right through the seat and into your pelvic region. Over time, this constant impact creates repetitive microtrauma, especially to veins that supply the scrotal area. Now, because the scrotum has minimal muscle or bone protection, these veins are more vulnerable. They get irritated, inflamed, and gradually lose their elasticity, leading to pooling of blood, veins, dilation, and eventually varicocele. So now that we understand the root cause, let's talk about how to prevent or manage this condition. First and foremost, if you suffer from constipation, address it immediately. One of the simplest and most effective addition you can make it psyllium husk, which is also known as isabgol. You can also take psyllium husk with the cup of warm milk, especially at bedtime. This combination is gentle on the stomach and works overnight to soften the stool and easy morning bowel movements. Also consider having a semi-liquid foods in your dinner like porridge or a vegetable soup. You want your bowel movement to be smooth and regular so that there is no excessive pushing or straining that increases pressure in the lower abdomen. That simple adjustment can dramatically reduce stress on the veins and near your scrotum. If you are not into the fitness or trying to gain weight, that's a great. Physical activity is important, but always listen to your body. And more importantly, always wear a supporter during a strength training or intense leg exercises. Now, if you have to use bike or a two-wheeler for a longer duration, try taking breaks during a long rides. Choose cooler time or the day to travel, or simply placing a clothes on your seats. These small practical changes can help reduce both temperature stress and repetitive impact trauma on the delicate veins, especially if bike riding is part of your daily routine. But what if you are already developed symptoms like a dull ache in the testicles, heaviness in scrotum, or visible enlarged veins? Most cases, especially in the early to moderate stages, can be managed naturally with the combination of body awareness, daily habits, and the lifestyle adjustment. Your body is intelligent and responsive. If you reduce internal pressure, support your core properly, manage your bowel health, and avoid excessive heat exposure, the inflammation and vein dilation can settle down over the time. Even fertility can improve when your circulation and hormonal environment stabilize. So to wrap up, if you are lean or dealing with varicocele, or if you are just been diagnosed, understand that your body is trying to tell you something. Respect the signals, make practical changes, support your system, and remember, with the right lifestyle and daily care, your body can repair itself naturally, safely, and without surgery. Thank you for watching. I hope you found this video helpful. See you in the next video.